Hello, all of you. Welcome to another class on med clinics. So, in dermatology, I'm Dr. Jazeer, your dermatology faculty. Can you just confirm with me if I'm audible and visible? So, if everything is fine, we'll directly jumpstart with today's session. So, this is in continuation to many other med clinic sessions that we have done. So, we have covered various topics in med clinic so far, like how should be your approach to pigmentary disorders, your approach to vesiculobullous disorders, your approach to infections in the skin, and a lot of diagnostic investigations that we do in dermatology and all. So today I have a very interesting topic, that is the skin in systemic diseases. Now, what are the diagnoses and the clues that you get from the skin? So this is a topic that I'll be discussing today. So as you know that dermatology is considered to be the young daughter of medicine, right? So which means that many of the diseases is very closely associated with medicine cases as well. So the skin being the most visible organ in our body. So that all of you know that the skin is the largest as well as the most visible organ. Since it is the most visible organ, the skin can show you a lot of diagnostic signs. Like if you are a very good observer, you'll be able to pick up that this sign can be seen in certain disease. So you can investigate for that disease and reach out to an early diagnosis. So I would like to do this topic today in a interactive way, where I intend to uh, bring multiple cases in front of you. I just want to present it as a case so that you'll be able to judge ki kaun sa, what are the possible differential diagnosis and how do we reach out to a diagnosis as well. Okay, so with your permission, if everything is fine, let me just continue now. So the learning objective today is to understand how the skin reflects systemic illness through clinical cases, because that is exactly what I have explained to you. And today what we will do is we will be doing it in a patient oriented format or a case based format is how we'll be doing it today. And we'll see what are the common patterns that you have to recognize in the skin so that you'll be able to diagnose the underlying systemic disease. Now, why skin matters? The skin is the most accessible diagnostic tool. This is what I told you earlier. The largest and the most visible organ, and it is the most accessible diagnostic tool. And a lot of diseases can show some specific dermatology clues. This is what we will be learning about today. Now, what is the plan for the day is let's go on a case-based approach. Now, what do you mean by case-based approach? I'll just give you a case scenarios, because rather than teaching you ki this is seen in this case, I feel that it is much more easier for you to learn and to understand if I present it to you in front of you as a clinical case, right? So to start with, let's start with an endocrinology simple case first. Okay, so this is going to be an easy case that we'll start with. So the first case is a 42-year-old with velvety dark patches in the skin, in the axilla and neck, and who is obese as well. So you have got multiple diagnostic clue. So when you get a patient, you get to know ki okay, a patient is a little bit obese, and this patient is complaining ki there is a dark patches over the axilla and the neck region. So if I just zoom this image for you, we can see that this is the velvety type of hyperpigmentation that you can see over the neck region as well as the axilla and all those regions. Now, what is the diagnosis here? So the diagnosis here, which is going to be a pretty much easy case for you. So here the diagnosis should be diabetes mellitus. That's going to be diabetes. Sorry. So here the diagnosis is going to be acanthosis nigricans. Acanthosis nigricans. So this is called as acanthosis nigricans, where you get a velvety kind of a hyperpigmentation over the body folds as well as over the neck region. Now, what are the associations? Why am I teaching this when I'm talking about the skin and the systemic diseases? What is the most common association of this disease? The most common association is going to be obesity. But along with obesity, there are multiple diseases with which acanthosis nigricans is associated. So what are those diseases which is going to be associated with acanthosis nigricans? So this can be PCOS, it can be diabetes mellitus, it can be any other metabolic syndromes, as well as rarely it can be associated with malignancy like GI malignancy as well. So these are the various types of diseases where you can see there is an association of acanthosis nigricans. Is that clear? So this first case that we have discussed right now is going to be acanthosis nigricans. As you know, there are many other cases which can be associated with endocrinological disease. Endocrinological disease as in it can be thyroid disease, it can be diabetes, etc. So now let's see what are these images. Now if a patient comes to you saying that there is some brownish atrophic kind of lesions that is present over the shin. In such cases, what is this diagnosis? Anybody in the chat box, please? So what is this diagnosis? So here what you can see is you can find a brown atrophic patches over the shin area. Now, this can be a marker of complications of diabetes, and this one is called as diabetic dermopathy. Diabetic dermopathy. So whenever you find a patient who complains to you that there are some brown atrophic patches, like what you can see here, then you will be asking the patient ki how long are you diabetic and whether there is a good diabetic control or not. And then you get to know that the patient is having a long standing history of diabetes, most probably with a poor control. Since this is a marker of complications, since it is a marker of DM complications. So what do we do is we will be investigating for diabetic retinopathy, diabetic nephropathy and all. So all those microvascular complications and all, we can just try to screen the patient. Clear? At the same time, if we have the same history, the patient is diabetic and the patient is having very large kind of lesions like this, which can be sometimes yellow in color as well. So a yellowish kind of a plaque lesion which you can find over the anterior part of the leg or the shin in a diabetic patient. What is this one called as? This is also associated as a cutaneous manifestation of diabetes. So all these are cutaneous manifestations of diabetes mellitus. This one is called as necrobiosis. This one is called necrobiosis lipoidica diabeticorum. Diabeticorum. Okay, that is what we call for this condition, and this is also associated with diabetes mellitus. Clear? Now, is there anything that you have in if in a patient who is having thyroid disease? Is there anything that is present over the anterior part of the shin in the exact area, in this area which is called as the anterior part of the shin? Is there any clinical finding that you can expect in a case of a patient who is having hyperthyroidism? Because this can be a differential diagnosis as well. So यहाँ पे just make a note of this, or I'll just write down the next page that in hyperthyroidism, if anybody knows the answer, feel free to answer in the chat box. So in hyperthyroidism, what is the thyroidism in the anterior part of the shin? What is the finding that you can see? The finding that you can see here is going to be called as, any idea? Last chance, 2 more seconds for you. So this is called as pretibial myxedema. Okay, this is called as pretibial myxedema is what you can find as a cutaneous manifestation in hyperthyroidism. Is that clear? So these are the images that we have learned till now. So diabetic dermopathy, necrobiosis lipoidica diabeticorum, as well as we also learned about acanthosis nigricans. All these things can be seen in a patient who is diabetic as well. So that is why I have discussed all these images together. And then one thing that should be in your mind is when it comes to hyperthyroidism, there is a condition called pretibial myxedema, which is also seen in the anterior part of the leg. So now let's see the next case. A 38-year-old with a dry skin, thinning of the lateral eyebrows and fatigue. So what is the diagnosis here? 38-year-old dry skin. So dry skin means we usually call it as cirrhosis. So patient is saying that there is a lot of dryness of my skin. So whenever there is a dry skin, there can be an associated itching as well. But the most important part here is there is a thinning of the lateral eyebrows. So this one, which we call it as lateral madarosis. So whenever you find this thing called as lateral madarosis, what is the thing that is coming to your mind? And the patient is obviously saying is way too fatigue. Okay, it's getting tired very fast. So here our diagnosis should be again hypothyroidism. So this loss of lateral eyebrows should raise a suspicion of hypothyroidism, and along with that you have getting enough other clues as well. So in this patient, if I get this kind of a patient in my OPD, what I would do is, since I can find there is a loss of lateral eyebrows, which can be seen in diseases like, let us say atopic dermatitis is one, hypothyroidism is another, leprosy is another. So all these things are going to be my differential diagnosis. But here, based on all these things together, I would be definitely sending the patient for an investigation called thyroid function test. So once the patient goes for thyroid function test, we'll be able to recognize that the patient's thyroid hormones are going to be less. That is why this is associated with hypothyroidism. It's associated with hypothyroidism. So now let's see another case. So in the next case, we have a 30-year-old woman with a purple striae on abdomen and facial acne. Now what comes to your mind when there is a purple striae? The patient is not pregnant, but you can see that there is a purple striae over the abdomen like this. So if there is a skin fragility, acne over the face, purple striae, if I give you one more clue, then it will be very easy for you to diagnose. So that is going to be a hump behind the neck. And if I give you one more clue, if you want, it's the patient may have a moon face as well. So round, puffy moon face, along with the purple striae, skin fragility, all these things. This is going to be because of Cushing's syndrome, isn't it? Cushing's syndrome. So this case is more or less going to resonate with Cushing syndrome. And please remember that these are all going to be very typical presentations. Like there is an underlying condition that is going on, but the patient is coming to you with skin manifestation. Skin manifestation kya hai? It is going to be a facial acne, who is a 30-year-old patient with a facial acne. And when you on physical examination, you see that there is something like this. The patient must have ignored these kind of things, thinking that okay, the patient has gained a lot of weight recently, so these are stretch marks. But these are called as purple striae, which is very typically seen in Cushing syndrome. Clear? So that is about this case as well. Shall I move to the next? Chalo. So moving to the next one. So now we talk about some of the cases about connective tissue disorders also, which means there is an underlying connective tissue disorders here, isn't it? So now let's see what is a case. So this case says that there is a 24-year-old woman with facial redness. So there is a erythema over the face, and after sun exposure, fatigue, oral ulcers. Hi Sanju, I hope all of you are keeping it able to follow me. So chalo, let's see what is the answer for this underlying condition. So if you see that there is a patient who is having a facial erythema, and the patient says that doctor, I'm unable to go to the sun because every time I go to the sun, this rashes is becoming more and more severe. And the patient is complaining that there is a recurrent history of oral ulcers. If you want a clue, I'll say that is the oral ulcer painful? The patient says that nay, there is an ulcer, but this is going to be painless. And usually I find these ulcers over the palate, and the patient is having fatigue as well. So in this case, how are you going to manage it? What we will definitely do is we will definitely send the patient for a anti-nuclear antibody test, isn't it? Because here what do we suspect here is called as systemic lupus erythematosus, which is going to be the most likely diagnosis when it comes to this kind of a clinical presentation. Okay, so that is one. And moving to one more case, which can also be related to a autoimmune or a connective tissue disorder. Let's see this one if you are able to answer. Excellent, Sanju, you're answering it right. So now let's see this one. A 55-year-old man with muscle weakness and violet discoloration around the eyes. So patient is ending up in a dermatology OPD. So what we can see is we ask the patient to close their eyes, and you can see that there is a violet color discoloration or a violet color erythema. Purple erythema can be seen. So what is this condition where the patient is also having additional symptoms? Now what is the additional symptom? The patient is complaining of muscle weakness. So I give you more clues here. And when I'm taking a detailed history, the patient says that I don't know why my office is in the third floor and I usually used to climb the stairs. But these days, by the time I climb one floor, I feel a lot of weakness in my muscles. Or in the morning when I used to groom myself, when I'm gonna comb my hair, these days I don't feel like combing my hair because I feel there is a weakness of my proximal muscles. So these are examples of the symptoms what the patient will complain about muscle weakness. And when you examine, you see a violet color discoloration around the eyes as well. So what I would do is whenever you see something like that, we can send the patient to see what are the what is the levels of CPK, isn't it? So we used to do CKMB when it comes to the heart, isn't it? Similarly, we can check for creatine phosphokinase levels in the blood, because here what am I suspecting? We are suspecting about dermatomyositis. Dermatomyositis. To reach out to a definitive diagnosis, we'll have to do a so to reach out to a definitive diagnosis, we have to do a muscle biopsy. We have to do a muscle biopsy. But here, dermatomyositis, we can see a lot of other findings as well. So in this patient, you can find this one finding as well. So when you ask the patient to just examine the entire body, the entire skin, you can see a finding like this. Now what is happening here is you can see that the patient is having a erythematous or a purple colored rash over the knuckles, isn't it? Over the interphalangeal joints, but you can see that the area in between the joints is all spared. The area in between the joints is all spared. Now, what is this finding? Excellent. This finding is called as the Gottron's papules. Gottron's papules. So when we are going to check this patient, we can see a lot of findings. It is not just the purple colored erythema. It is also called as a heliotrope rash. So this image is actually called as heliotrope rash, which means it is compared to a heliotrope flower. Okay, and along with that you can find Gottron's papules, and you can see some V-shaped erythema over the anterior part of the chest. V-shaped erythema can be seen over the anterior part of the chest, and we can see something called as a shawl sign as well. So what's a shawl sign? Like how we wear a shawl, similarly we can see that there is a photosensitive rash which can be seen over the body. If you examine the palms of this patient, you can find mechanic's hand. Mechanic's hand. Okay, those rough surfaced hands that can be seen. So all these are going to be additional findings, but please remember, whenever patient complains about muscle weakness along with some purple erythema in the skin, think about dermatomyositis. Many a times dermatomyositis can be a sign of a internal malignancy. So it's very important to rule out any internal malignancy as well. So more than a skin symptom, it's very important to rule out internal malignancy when you diagnose dermatomyositis. So moving to the next one, a woman with a joint pain, nodules over the elbows and ulcers over the legs. So what is this going to be? Any idea? So a patient का primary symptom है joint pain, which means, so whenever you find this thing कि joint pain, tell yourself, tell the medical terminology. अच्छा आपको joint pain है, so this can be arthritis. So what type of arthritis? Now you can see that there are nodules over the elbows. So when there are nodules over the elbows, what things should come to your mind? It can be a rheumatoid nodule, and the patient is having ulcer as well. So here, based on this very typical case history, what we are going to suspect here is going to be rheumatoid arthritis along with rheumatoid nodules, as well as why does the patient develop these ulcers over the legs? So these are going to be vasculitic ulcers. These are vasculitic ulcers as well. So that is how the typical presentation is going to be. So this is how you can again make out, and then you can do some investigations like RA factor and also take an X-ray. You can reach out to a diagnosis of rheumatoid arthritis and then start treating the patient. So moving to the next one, a patient with a tight, shiny skin over the fingers and the face. So here, what is happening is the patient may look young for age. Like if it is a 40-year-old patient, the patient may look like he's just 30. The reason is the skin is not going to, the skin is going to be very tight, which means you don't see any kind of a wrinkle and all. It looks like a very clear skin. And at the same time, the patient is having a lot of difficulty saying that there is so much of tightness of my skin in my fingers as well. So fingers and face is involved. So acrofacial. So what is the disease that I'm talking about here? Any idea? So what you see here in this finger, this one is called as sclerodactyly. It's called as sclerodactyly. So if anybody knows the answer, feel free to interact in the chat box. Just answer with the comments. Okay, so that will make the class more interactive and more interesting. So here this is called as sclerodactyly. Sclero means thickening. This is called thickening, and dactyly obviously means fingers. So thickening of the fingers, skin of the fingers is called sclerodactyly, and there is a similar change over the face as well. So what is the ultimate diagnosis here? Anybody? So this should be scleroderma. So this can be a case of scleroderma. So there are a lot of other findings in scleroderma, because you know that there is a limited type of scleroderma which is associated with the CREST syndrome. There is a diffuse type of scleroderma as well. But in all these cases, when you see a patient who is complaining, this would be the initial symptom. Yeah, I feel that the skin of my face is becoming more tight now these days. At the same time, as the disease would progress, what happens, because of this tightness, the patient may feel difficulty in talking. So the entire area around the lips and all gets shrunken. So all these are going to be the features of this condition called as scleroderma. So here the patient can present to you with shiny skin. Because of it is becoming more tight, it's going to be shiny skin, tight skin over the fingers as well as the face. So here we suspect about scleroderma. So now let's see the next one. A 60-year-old dialysis patient. So the question itself says it's a dialysis patient. Severe itching and white band on nails. So here what is happening is a patient who is undergoing dialysis. We already know that the diagnosis here is going to be chronic renal failure So the patient is having a chronic renal failure. So in these patients of chronic renal failure, it's a very, very common complaint to have severe itching, which is called as pruritus. Okay, this can be heavily distressing to the patient because it is going to be severe itching. Along with that, you can also find a white band on the nails. I don't know if I'm having an image. Yeah. So this is a kind of an image here. Okay, you can see that almost 50% of the nails over the proximal part has turned white in color. So when you find this whitish discoloration over the proximal part, what do we call it as? We call it as half and half nails. So this is a very common nail finding in patients of chronic renal failure. It is also called as Lindsay nails. It's also called Lindsay nails. So Lindsay nails or half and half nails, this is how a patient of chronic renal failure can present to you, and this is going to be the diagnosis. Now what about this one? So this is another skin finding that you can see in a patient with a chronic renal failure, where there is going to be very painful skin necrosis. There is going to be a very painful skin necrosis. So what do you call for this painful skin necrosis? Any idea? So what do we call for this painful skin necrosis? This is called as calciphylaxis. So calciphylaxis is a condition where a patient will complain of a very severe painful skin necrosis seen in patients with chronic renal failure. So this is going to be a very much more a severe condition, right? So that is about renal diseases. See, what are we discussing here during this session is that I'm talking about various presentations over the skin. But when you see these kind of presentations, what is the clinical picture or what are the diagnoses that should come to your mind based on these kind of clinical symptoms? That is what is being discussed here, correct? Okay. So now let's see the next one. A man with jaundice. Jaundice means there should be some yellowish hue over the skin. So this is going to be our finding when it comes to the skin. And the patient is also having spider angioma and palmar erythema. So where do you find or in which kind of patients are you expecting to see all these things? Jaundice matlab itself, you know that, okay, we are talking about which organ system here? Okay, we are going to talk about the liver. So along with that, if you find these kind of lesions, so this one is called as a spider angioma. You can see that it is spreading like this. So this one is called as spider angioma. So along with spider angioma, the patient is complaining that there is a erythema over the palms as well. So palmar erythema, spider angioma, along with jaundice in the skin. So we are thinking about a chronic liver disease here. Can be because of anything, because we can't say exactly why. So it can be because of hepatitis, it can be due to alcoholic hepatitis or anything as such. So all these are going to give you a clue that there is a chronic liver disease in this case, isn't it? So that is how you need to think about these kind of cases as well. So now let's move to the next one. Now there are many hematological as well as nutritional disorders which can also come to our OPD saying that okay मुझे ये symptoms है अभी. So what is this? So they are thinking that these are some skin related disease, whereas it is a systemic disorder or a disease that they would be having. So let's see this one. What is the diagnosis in a patient who is a vegetarian woman with pain in the tongue, fatigue, and hyperpigmented knuckles? So whenever there is a hyperpigmentation of the knuckles, it is one of a very common differential diagnosis. Ki this is going to be, the clue is it is not hematological. The clue for you is this is nutritional. Any I think we just got disconnected in between. So let's continue now. So I was talking about this very typical case. I hope I'm audible. Okay. So please do confirm if there is any issues with my audio or my video. So here, what do we see here is this is a case which I was discussing now, and I guess it got disconnected in between. So here, this one is whenever you find a patient who is complaining of a waxy no papules over the skin, waxy papules along with a purpura. So then, and this purpura is always appearing around the eyes then after a minor trauma. So this is called as amyloidosis. It's called as amyloidosis. Okay. So now let's see another one. You know that sometimes some signs that you can see over the skin, this can be because of it can be a marker of internal malignancy. Like today I told you that if a patient is having acanthosis nigricans, then it is rarely associated with malignancy like the GI adenocarcinoma. Similarly, if you find that there is a patient who is having a sudden onset of multiple brown plaque lesions like this. So if a patient develops multiple multiple brown colored plaque lesions over the body, something like this, which is having a stuck on appearance, which is having a stuck on appearance. What do you mean by a stuck on appearance? It is like, the lesion is going to be glued out to the skin. The patient would be always trying to pick on these lesions and will be trying to remove this lesion. That is a stuck on appearance. Whenever you find something like this may be an important clinical sign for you in surgery as well. So this one is called as laser trelat sign. So this is called as laser trelat sign. This sign is a marker of malignancy. The sign is a marker of malignancy. And what malignancy is it most commonly associated? Anyone in the chat box? Because it's a very important clue for you. So this is usually associated with GI adenocarcinoma. It is usually associated with GI adenocarcinoma. Okay, that is a sign of an internal malignancy. Okay, so any other internal malignancy signs that we can see in the skin? Signs of internal malignancy. So any other that you would remember? Like let's say even today we discussed about acanthosis nigricans. Acanthosis nigricans. So even though this is going to be quite rare that acanthosis nigricans is associated with malignancy, but still you'll keep this as one of the things in your mind. The second one also we discussed today is when a patient is having symptoms of dermatomyositis. We have to always rule out a malignancy, right? So another one that would come to your mind is a type of an erythema. What is this erythema? So this is called as necrolytic migratory erythema, which is associated with glucagonoma. So this is associated with glucagonoma. Okay, necrolytic migratory erythema, which is associated with glucagonoma. So all these things are going to be signs of internal malignancy when it comes to the skin. So now let's see a few more cases. The next case is that a young man with oral white patches, purple skin nodules, and extensive molluscum. So it's a mixed presentation. There is some white patches in the oral mucosa, which looks like this. So here what I can see is there is a whitish discoloration over the lateral part of the tongue. So Narasimha says it is leukoplakia. You're very close, Narasimha. It's a very good differential. Now, can we try to make it more specific? Correlate all these things. Where can we see a purple color nodule? Oral patches and extensive molluscum. So what is molluscum? It is a viral disease, isn't it? It is a viral disease, but usually it is seen in children. And in an adult, if there is extensive molluscum, it should raise a suspicion about a immunodeficiency. Immunodeficiency should be coming to our mind. So if having said immunodeficiency, now what is this tongue finding called, which can be seen in an immunocompromised patient? Lateral part of the tongue is white, that is whitish discoloration of lateral part of the lateral part of the tongue. So this is called as oral hairy leukoplakia. So this one is called as oral hairy leukoplakia. Clear? So Narasimha, you are very close. Okay, you said it as leukoplakia. Yes, but this one, to be more specific, it's called as oral hairy leukoplakia. So this is usually seen in HIV patients. It is usually seen in HIV patients. Clear? And extensive molluscum, I have not got that image, but extensive molluscum can also be seen in HIV patients. Okay, that is going to be seen in immunocompromised patient. So what is this one? When there is a persistent seborrheic dermatitis, severe pruritic papular rash in immunocompromised patient. So I guess this one is an example of extensive molluscum. Extensive molluscum. How can we differentiate this with mixed? I didn't understand what you mean by mixed. If you are talking about, can you please be specific now? Uh, which mixed do you mean? So if you are talking about leukoplakia, what do you mean by leukoplakia? You can see some whitish discoloration over the skin, over the tongue, right? So in the cases of leukoplakia, so what we can find here is there is a whitish patch. So this whitish patch can be due to various reasons. One is that it can be due to candidiasis. Candidiasis. So in candidiasis, what happens? There is a membranous coating that can be seen over the tongue and all. So this one is also called as the oral thrush. This one is also called as the oral thrush. That is going to be one of the differential diagnosis. The second one can be what we have learned today, that is oral hairy leukoplakia. Hairy leukoplakia. So in oral hairy leukoplakia, what will happen is when you examine the tongue lesion, the whitish discoloration, this can be more seen towards the lateral part of the tongue. It can be seen over the lateral part of the tongue, but not throughout the entire tongue. Another type is going to be something called as a geographical tongue. So in geographical tongue, there is not anything specific to be done, because this is just considered to be a physiological change or a normal finding. So just need to reassure the patient. Rarely we can also find erythroplakia. Erythroplakia means there is some part of the tongue which has got reddish discoloration. And remember, erythroplakia, this erythroplakia is going to be the most malignant tongue finding. So that is going to be the most malignant tongue finding. Or what is going to be most pre-malignant too, or what has more chances of changing it to a malignancy, it is going to be erythroplakia. It is going to be erythroplakia. Whereas if you find some darker hyperpigmented changes within the tongue, okay, some dark brown or blackish kind of a hyperpigmented changes over the tongue, then you again change your diagnosis. You think about vitamin B12 deficiency, some nutritional deficiency and all. That clear, Narasimha? That is how you can differentiate and move. Clear? So now let's go to the next one. Again, if you find that there is a patient who is having severe dandruff, very severe dandruff, which is not resolving with ketoconazole, selenium sulfide, or it does not resolve with, you're thinking about scalp psoriasis, and still if you apply some salicylic acid and all, it does not resolve. severe seborrheic dermatitis, as well as severe pruritus in an immunocompromised patient. This is again going to be HIV. Okay, severe seborrheic dermatitis should always raise suspicion of HIV again, because this is a place where opportunistic infections and tumors can be seen. And just going back to the previous one, I don't know if we have discussed about it, because in the previous one we discussed about this purple colored skin nodules, right? So what is this purple colored skin nodules? काफी important है. Last time in NEET PG they gave you a purple colored lesions within the oral mucosa. It can be seen over the mucosa as well as over the skin. So this is called as Kaposi sarcoma. So this is called as Kaposi sarcoma. Okay. So all these things are going to be associated with HIV. So if I ask you, what are the cutaneous manifestations in HIV? Then we have discussed multiple. Severe seborrheic dermatitis हो गया, isn't it? Oral hairy leukoplakia is another one. Violaceous papules or nodules in the oral mucosa or the skin, which is called as Kaposi sarcoma, is another one. There can be extensive molluscum contagiosum, extensive herpes simplex virus infection. So all those infections will become way too extensive. Multiple opportunistic infections can also be seen over the skin, like penicillin marneffei and all those things, Talaromyces marneffei and all. Those are going to be some kind of a deep fungal infections which can be seen in HIV patients. So all these things can be seen in HIV. So now let's move to the next one. A patient is complaining of a clubbing of the nails and leukonychia. So till now we were talking about leukoplakia. Leukoplakia matlab that was tongue. Abhi leukonychia matlab it is a nails. So a patient who is having nail clubbing and leukonychia, which is associated with chronic cough. So this is called as clubbing. What is happening? There is a increased curvature of the nails. So when you find that there is an increased curvature of the nails, very good. Kaposi sarcoma is associated with HHV8. Excellent. That is the right association. Okay, so now let's come back to this one where you can find clubbing. So whenever you find this clubbing, and this can be either because of a lung disease or it can be due to liver disease. But since chronic cough is also mentioned, so you are going to suspect a chronic lung disease here. So patient may come to our OPD, that is in dermatology OPD, but it can be due to some underlying systemic disease which can affect the lungs as well. So this can be due to a chronic lung disease. You know that clubbing and all is not going to be very typical. It can be associated with various diseases, right? It can be associated with bronchogenic carcinoma. It can be associated with multiple diseases and many other changes like leukonychia and all. It is also going to be non-specific. It is also going to be non-specific. So now let's talk about something in children. We have been talking about a lot of adults today. Now let's talk about something in children. What do you suspect if a child comes to you with a corkscrew hair and a bleeding gums? Now it's very, very important to have this clarity. The child is coming with a bleeding gums. So you should not go into a misdiagnosis thinking that it is going to be some bleeding diastasis, some bleeding disorders and all. When you find these kind of findings together, corkscrew hair, or let us say it is also called as swan neck deformity of the hair, along with the bleeding gums and all, then think about some vitamin deficiency. What is the vitamin deficiency I should come to your mind? Vitamin C deficiency, which is also called as scurvy. It's also called as scurvy. So many a times what happens that scurvy may get misdiagnosed because the patient is having bleeding, है ना? So bleeding of the gums and all. So you are going to think that okay, this may be some bleeding disorder that is present in this baby. or a child, and you should not go into any kind of a misdiagnosis here. Okay, that is about this pediatric case. So that is it. We have discussed about multiple case scenarios. So the takeaway message here is the skin being the largest and the most visible organ system in our body. So any changes in the skin, it need not be skin diseases. Like, we should not limit ourselves thinking that it can be a fungal skin infection like tinea. It may be a plague skin disease like psoriasis, vitiligo, all those things. There are many more diseases more than what we learn in the skin, isn't it? So this our system, that the skin can be very closely associated with internal medicine, the diseases that you learn in internal medicine. So that is why we have discussed about cases like rheumatoid arthritis today. We have discussed about SLE today, scleroderma today, and multiple vitamin deficiencies and all. So, and even immunocompromised states like HIV. So we have to keep our differential diagnosis broad. We should be able to correlate between different organ systems, and that is why we have to look into the morphology, distribution, and associated systemic symptoms to reach out to a proper diagnosis. So if there is any queries, I'll be happy to take your questions today. So this is I think the several sessions we have done in med clinics, and we are adding more and more topics every time. If there is any questions, I'll be happy to answer. Otherwise, please go through the app and explore the clinical corner. It's going to be really interesting, because once you go to the wards, once you start seeing your patients, and it is always interesting when you know things. When you know things, you'll be able to correlate it better. You'll be able to relate it with multiple diseases, and that is how learning becomes interesting, isn't it? So I look forward to meeting all of you again with more live sessions like this, and I hope you enjoyed the session. So we will be in touch, and we'll see you for the next session. Thank you so much.